Let's now welcome the Minister of the Department of Health, Dr. Aaron Motsoaledi. Minister Motsoaledi, a very good afternoon to you and a pleasure to speak to you again. Thank you so much for your time. So, Minister, when we go back to February, PEPFAR-funded HIV organizations who received their funds through the U.S. agency USAID woke up to letters that were sent overnight telling them their grants have been ended permanently. In March, you told the nation that South Africa had the capacity to fund its own AIDS programs from the fiscus. Just speak to us, Minister, then about your efforts as the Health Department, in particular the progress that has been made to mitigate the impact of this funding withdrawal by the US government.
Thank you very much. Maybe to understand, if I have to put things in perspective to understand, we are spending 46.8 billion rand on the HIV, AIDS and TB program this year in South Africa. PEPFAR is contributing 7.9 billion rand of that. So when that money gets withdrawn, it will be 7.9 billion rand. PEPFAR was helping us in 27 districts out of the 52 districts of the country, 27 districts in 9 provinces, because Northern Cape is not part of this. It's not part of the PEPFAR funding. So the number of people in these 27 districts who are working on HIV/AIDS are 271,606. Out of that number, 15,000 are funded by PEPFAR. And it so happened that these are the people of interest. But 8,000 of those, their jobs have come to an immediate end with the announcement, because they were paid by PEPFAR through USAID. Yeah. The others who are paid by PEPFAR through CDC, Center for Disease Control in America, they still have a reprieve until at least September. So this is where we are. But when it comes to ARVs, the antiretrovirals, for the 5.7 million people who are on antiretrovirals, when it comes to that, we pay for 90% of that from our fiscus. PEPFAR has not been buying ARV for us. We buy them for ourselves. And then 10%, we buy up to 90%, then 10% is bought for us by the Global Fund. Now, this is where we are at the present moment.
I want to just talk about the 8,000 employees that you mentioned, and just also bring our viewers and give them context. So of the 271,000 people or so working in the HIV/AIDS program across these 27 districts that you've also just mentioned, Minister, so 15,539 were funded then by PEPFAR. We understand that over 7,400 people are still employed, though, because they are funded through the CDC. So is there a plan then to absorb the rest, the 8,061, I believe, of these unemployed health workers into the public health system at this stage?
If we had a plan to absorb them, it means we'll have a budget for this. You are aware that we're struggling even to employ people who we need, you remember our issue with employment of doctors, nurses, and other healthcare professionals. So what we've been doing is, when we've been meeting funders, we're putting our needs, including the employment of these 8,000 people. We met a lot of funders, international funders and philanthropists. We also met and communicated with countries that can help. But up to so far, none of them has been able to tell us clearly. They just said they are willing to help. But what they made very clear is that none of them is in a position to replace PEPFAR. They said they simply don't have any capacity whatsoever to replace PEPFAR. But if they want to help, they'll inform us in which areas do they want to help. And up to so far, none of has really come to the fore and say, we are ready now, we'll help you on this one and that one.
And Minister, in your briefing, you rejected claims that South Africa's HIV/AIDS program is collapsing. And I want to just talk about maybe the concerns come from that 10% that you were talking about in terms of the 5.7 million people who still rely on ARVs. And again, these 8,000 or so employees without a job. Just in terms of allaying those fears then, in terms of those other agencies who are saying that, we're still in dire streets, in dire states here.
Just come again. I really didn't understand the question very well. I'm sorry about that.
I'm saying the 10% that you speak of funding that is still needed, to be sourced by government, of the 5.7 million people that you speak of that are on ARVs, of course, 90% of them that you are funding, as well as the 8,000 people that are still now unemployed because of the PEPFAR withdrawal. That's probably where the concern is coming. And I said that you rejected claims that the system is then collapsing.
Yes, I did, and I still do. The 10% has always been funded by Global Fund. In other words, every year, the amount of ARVs that are consumed by the 5.9 million South Africans or people on ARVs, 90% of them, we buy them from the fiscus. It is in our budget every year. But every year, 10% comes from the Global Fund. So on the issue of ARVs, there is no change whatsoever. There's no crisis. It's not affected by the pull-out of PEPFAR. So that one is clear. Now, on the 8,000 people, yes, it is true that no country has come forward to say we can give you money to employ these people. Because as you know, employing people is not a very easy thing. It's not a once-off thing. It's not like buying ARVs, etc., or helping people with capacity building. So on the ARVs, we have got no problem because apart from what I've told you, the Global Fund conducted us after Trump pulled out. They contacted us and say, we can order ARVs for up to 1 billion rand and they will pay. And we've made that order. So there's no fear in that regard. That's why we bravely say one of the things we want to achieve is that no South African whatsoever must ever run out of ARVs or must not get ARVs because of our shortcomings. If people don't get ARVs, it might be because of logistical issues or problems with themselves, but we will make sure that every one of the 5 million people who are on ARVs gets them, and every one of the new 1.1 million additional people who we want to add will get their ARVs.